Hi everyone, Dr. Nemechek here. A very common thing I'll see, patients come in, and either the kids or adults, and one of the tests that's been done is some allergy testing, some blood work. And quite commonly, there's a whole bunch of stuff that the people the patients are being told that they're allergic to. And I want to offer a different explanation for what's going on. Now, can people become allergic to food? Sure, I think it's a very real thing. But they aren't going to have like 17 things on the test, okay? Now, let's just talk about the test. The best test for an allergic response to a food is you put the food in somebody's mouth and you monitor them physically about what happens, okay? They consider that the gold standard. The next test is you do skin testing. That's the next most accurate test. And then the least most accurate tests are the blood tests that you draw. Now, let's talk about this. So here I've got the small intestine, here's stomach, small intestine, large intestine, and stuff is absorbed in the bloodstream here. All right. Now, if somebody has SIBO, where you have normal bacteria in the wrong place, and remember this is only one, maybe two species up here, but you're going to have 10,000, 100,000 times the bacteria up there, okay? This is what overwhelms this, causes leaky gut. Stuff will literally leak out through the seam. And I'm going to show you a little cut here. So here, if you think this is a tube and we've cut it, okay? Here, this is the small intestine. Now this is a mouse, small intestine. Ours is built very much the same, except for our little villi here are very tiny. And then you have this little barrier here. Now that's only one cell thick, okay? Normally the small intestine is almost sterile, so you don't need much to have stuff to prevent stuff from leaking in the body. But now you have 10,000, 100,000 times the bacteria. Stuff will leak down through this space. Now right here in this space in the small intestine, and actually all the way up into the esophagus, is 70% of all the white blood cells in your body, including plasma cells and mast cells that are going to release these chemicals called antibodies that are detected in your allergy testing. Okay? So here's the kind of story, and I hear this not too infrequently. There's a gentleman, this was a while back, I remember him because he was kind of comical, very nice guy. So he's like, so I go to this doctor, he does this thing, he says, man, you're allergic to all these foods. And I'm like, those are all my favorite foods. And he says, the only thing you aren't allergic to is corn, rice, and chicken. Now, basically what was happening is all the foods he was eating were leaking in here and were detectable by the test. It wasn't really that he was allergic to them. It was really more an indication that he had leaky gut. So anyhow, he eats corn, rice, chicken for a couple months. He goes back, he said, I was about to put a gun in my head. I hate corn, rice, and chicken now. He goes back, gets his test done, and the doctor said, wow, all your other allergies went away, and now you're just allergic to corn, rice, and chicken. What had happened is, now those are the foods he's eating and he's reacting to. I've heard this a lot from parents and patients. Okay? So, really, this broad level, you get these leaky gut, these allergy tests, these blood tests, they really aren't often a true allergic reaction phenomena. They are, the primary thing is leaky gut into these white blood cells, some of which are your mast cells and your eosinophils that are going to plasma cells that are going to respond and create these antibodies, all right? And those cells, and people say, oh no, I get an allergy because I get hives. These cells are going to release histamine that'll give you hives. My point is that's not the primary thing. The primary thing is the leak. And if you take some inulin or rifaximin to balance up you're like this, you take inulin or rifaximin, get rid of those excess bacteria, the leaky gut heals up pretty fast. You're going to find that the vast majority of all those foods now don't bother you at all. That's all. Just I want you to think about that. Now, note, you got severe allergy to something like peanuts and you almost go into shock. Don't try this and eat peanuts again. It's too risky. But for people who have these tests that don't make sense in terms of just their experience and what the test is telling them, you probably just have leaky gut and not a true allergy reaction. So hope that's helpful for everybody. You all have a good day.